Hi, my name is Valerie. I'm one of the nurses at the San Antonio Orthopedic Group. This video is going to show you how to prepare for your surgery, what to expect the day you're here, and what to do once you get home. Getting started, we're going to look at your house. So make sure that everything on the floor is picked up, rugs, cords, nothing that you could possibly trip on. Also, make sure all the rooms are well lit when you walk into them, and that there's all the frequently used items are waist level or higher. Take a look at your chairs, sofas, recliners. If there's any where your hips are lower than your knees when you're sitting down, you're not going to want to sit there after the surgery. So put some pillows, blankets to lift yourself up higher. As far as the equipment, we should have already talked to you about that. Everyone should get a rolling walker. If you need any other additional items, just let the nurse know. Now, before the surgery, we want your legs strong coming in. So there are a set of exercises on page 10 and 11 that we want you to get started on. Do these twice a day, 20 minutes at a time. If there's one on there that causes you pain, just skip that one and do all the rest. We don't want you to come in with a swollen joint just because you were trying to get these exercises in. Now, our timeline for surgery. 5 days before, we ask that you don't do any shaving around that operative area. We don't want any nicks or cuts in the skin that could have bacteria come in and create a rash. Now, the day before your surgery, now if this is on a Monday, your surgery, then we'll call you on Friday, but the coordinator will do two things for you. They're gonna call you and let you know what time to come in on surgery day, and they're also gonna send your prescriptions to the pharmacy. Now, the night before your surgery, you're gonna use a special soap called HepaCleanse. This is gonna start to prep and clean your skin for surgery. You'll use a good amount on a clean washcloth and scrub from the neck down, avoiding the private areas. After this shower, we ask that you don't use any soaps, lotions, or creams on your skin. Deodorant is okay though, as long as it's a solid stick, so no sprays. Also, we ask that you don't eat anything after midnight, so that includes water, coffee, gum, ice, mints, or candy. Now, the morning of the surgery, we're gonna have you take a second shower with that soap. The same way, from the neck down, avoid the private areas, but this time, we want you to come in wearing clean, loose clothing, something very comfortable, with an elastic waistband like gym shorts, sweatpants, t-shirt, tennis shoes, or for the ladies, you can even wear a comfortable loose-fitting dress. You can also brush your teeth, just make sure you don't swallow any of the water, and the nurse will go over with you what you can take the morning of the surgery and what you cannot. But if there are any medications that you do have to bring with you, just remember to bring those. You don't have to use any makeup, hair products, or lotions on your skin, but please leave all your valuables at home. Rings, watches, leave those behind. Just bring your phone with you, arrive at the scheduled time, and make sure you have a driver to be able to take you back home after surgery. Once you arrive at the surgery center, you're gonna check in at the front desk. They'll get you registered for your surgery, and then you'll go up to the surgical floor. Once you're up there, your family member can have a seat in the waiting room while they take you back to go over your history and get you all prepped for surgery. Once you're in the gown, ready to go, your family can come and wait with you until your surgeon comes by and chats with you for a little bit. Our anesthesia team will talk with you too. They'll tell you about the two types of anesthesia you're gonna have. General anesthesia will be given. That's the gases that will put you completely asleep so you don't know what's going on during the surgery. They do place a tube in your throat to help you breathe, so you might have some irritation from that afterwards. But you're also gonna be getting a regional anesthetic, and that's something called a nerve block. That will be an injection in that extremity to help numb the pain after surgery. Once the anesthesiologist is done explaining that and your surgeon's ready to go, the nurse will come and give you some medication to help you get really sleepy and then take you to the back to get started. At that point, your family can go back into the waiting room, come down to the lobby, wait in their car, go grab something to eat. They don't have to stay, but if they do leave the floor, just remind them to keep their ringer on and answer any unknown numbers. That is how the doctor will call after the surgery, so we want to make sure we don't get any missed calls. Now, after the surgery, they will take you to recovery. We'll have all the monitors checking your vitals. Once you wake up, we'll let you know surgery is finished, and then we'll see how you're doing with your pain. We do have a pain scale, a 0 to 10, that we use to help evaluate the pain. If you wake up with more pain than you expected, we do have fentanyl, morphine, Dilaudid to give you, but those medications are very strong and they do have very bad side effects. So the less we can give you, the better. If you can tolerate what you're feeling, we'll move you on to the last part of recovery where we'll give you a pain pill. but if not, they will give you just enough of those pain medications to take the edge off of the pain, not to take it away completely. And the next step would be the pain pill. Coming out of surgery, you're going to have some compression socks on your legs. If the doctor orders them for you, we will give you a second pair to go home with. You will also wake up with an ice pack. That ice pack doesn't last very long and tends to get soggy and leaky after a while. So please make sure you have something ready at home, whether it's ice packs, gel packs, Ziploc bags of ice, or the cryotherapy. Just make sure you have good coverage of that extremity afterwards, front, back, and sides. You are a fall risk because of the medications that you received after surgery, so please, while you're with us, don't get up without a nurse or an aide with you, and make sure there's something on over those compression socks. They, by themselves, are very slippery. They're like pantyhose. We will give you a pair of non-slip socks so you can either wear those or your own shoes. But even at home, if you have hardwood floors or tile, make sure you have something on over your feet. Now, before you head home, the nurses will go over the discharge instructions with you. They'll answer all of your questions about those. We'll also make sure that the prescriptions are either already picked up or waiting for you at the pharmacy. Now, if you haven't heard anything from the pharmacy about prescriptions being ready, please let the recovery nurses know so we can contact the coordinator and figure out what's going on with the pharmacy. We do not want you to leave without knowing that you have pain medication for home. We'll make sure that you have the equipment, so if you already have a rolling walker, make sure you bring that in with you. If not, we'll give that to you the day of the surgery. After surgery, you will have home health. That will be a company that will send a nurse and a therapist to your home for a number of weeks. After that time, you will go to an outpatient therapy. In the meantime, please continue using your walker until a therapist clears you. Don't make that decision on your own that you think you're walking fine and don't need it anymore, and then you have an accident and fall because you weren't ready. As far as the dressing, I will let the recovery nurses give most of the details on how to care for that. The only thing I will tell you is to make sure it doesn't have any tears in it, and keep an eye on the drainage. There will be a little bit coming through, but if it's saturating the little pad in the middle, that's when you want to let us know so we can get that changed out. Always look for any signs of infection. If the skin around the dressing looks red, hot, hurts, or if you have a fever, let the office know right away, but always try to prevent infection by washing your hands often with warm water and soap. Now that you're home, we do want you to walk about every hour while you're awake. And that can be a trip to the bathroom, a trip to the kitchen, a walk around the living room, just some form of getting up and moving. Not only will that help the joint move and recover, but it will help you prevent blood clots by not laying down for too long. If you have any stairs in the home, we ask that you go up with a good and down with a bad. So that will have you go up with the good leg, so the non-operative leg. That will do all the work to lift yourself up, with the operative leg staying completely straight. Going down the stairs, you're going to go down with a bad, so you're going to lead with the surgical leg, keeping that leg straight, and the non-operative leg is going to do all the work to slowly lower yourself down. Just make sure you're always holding onto the rail and that someone is with you the first time you go up or down stairs. Now, managing your pain, we're going to do our best to get that pain under control when you leave, but keep up with those pain pills, please. We'll write down the time you take the pain pill with us so you know when to take the next one at home. So set an alarm on your phone, and if you have to wake up in the middle of the night, do it. You don't want to go 7 to 8 hours without taking anything and you wake up with a lot of pain, because once it's there, it's very hard to get back under control. But keep up with the ice as well. Ice it all around that joint to help with the pain. The more you ice it, the less pills you will need. Have a good diet when you get home. Lots of protein, chicken, fish, lean red meats. We want your body to have everything it needs to recover. Also, increase your water intake and your fiber. Constipation can happen very quickly after surgery. So supplement with your diet first by eating raw fruits and vegetables, but if you need them, those over-the-counter stool softeners like Miralax or Colace. Just try to stay away from the stimulants and laxatives. Let your dentist know that you had a replacement. Some of them have a protocol that have their patients take an antibiotic before they come in for any dental work. But we don't want you to see them for 3 months after the surgery. Now, as far as driving, if this is your right leg that it's being operated on, usually that's about 3 or 4 weeks that you're unable to drive. If it's your left, typically about 2 or 3. But go to that first follow-up appointment. That'll be about 10 to 14 days after the surgery. If you're doing really well, you're not taking pain medications, and you have good strength in your legs, your doctor might clear you to drive at that time. Blood clots is always a risk with any surgery, and the doctor will put several measures in place to help prevent that. You'll be wearing those compression socks, you're going to be getting up every hour to walk, and you're also going to be doing those foot pumps. But also, your doctor is going to put you on an aspirin for several weeks after the surgery. However, if you have any pain, swelling, or tenderness in your calves, please go to the emergency room and have them do an ultrasound to check for a clot. Or if you have any chest pain, signs of a stroke, or trouble breathing, call 911 right away. Now, the do's and don'ts after surgery: just try not to get up too quickly the first 24 hours after surgery. You still have some of those medications swirling around, and we don't want you to get dizzy or fall. Same thing goes with bending over. Have family help you pick things up off the floor and put socks and shoes on. Now, we already talked about chairs being higher is better, nothing with the hips below the knees, and same thing goes for the car you're going to bring in that day. Just one that's easy for you to get in and out of, but typically an SUV or truck is better. Showers should be okay the day after surgery. Just remember, check for any tears or holes in the dressing, but also no submersion underwater. So baths, hot tubs, swimming pools are out for several weeks. Now, make sure you get the doctor's okay before you start any exercises: running, biking, climbing ladders, or dancing. And remember, no crossing the legs and no bending over. Now, if you are a total hip patient, we don't want you to do any inward rotation of that operative leg, so be very careful when you're turning around. Just do little steps to get yourself there. Now, in the back of this booklet, there are a couple of pages that go over frequently asked questions. I'll let you look over those. So the last thing I'll mention is just remember, you're healthy. You just have a new joint. You have to get up and use it. So walk on it, do all the stretches and flexion, but remember, take care of yourself. Get lots of rest, eat well, drink lots of water, take your medications, and always look for any signs of infection. I hope you found this video helpful. I'll see you at your pre-op visit.